to 56% of women can have a sleep difficulty.
You saw like 40 to 56%, but even 25% have proper insomnia disorder. Also with age as well, things like melatonin naturally tend to reduce. In terms of other medical conditions and also medications as well, which we have to think about, there are various causes that can cause that disruption to our normal sleep.
A good sleep, to fall asleep, to stay asleep, what is happening in our brain?
If you think about sleep, it doesn't serve much function when you think evolutionary point of view. So our ancestors, when you're sleeping, you can get eaten by a tiger, you're not reproducing, you're not finding food. Like, it doesn't on the surface look like it's got much function. And yet we're still here sleeping for 7 to 9 hours per day. So there's got to be something in there that means that we need sleep.
This woman say that they wake up early in the morning around 3-4 a.m. and can't get back to sleep. So what is your thought on that?
Because even in the definition of insomnia, if we're starting to talk about more insomnia, it can be all three: problem falling asleep, staying asleep, and also waking up too early.
Oh, there is a report saying that women need more sleep than men. What is your opinion on that?
Yeah, it's a really good point. So sleep need is one of those things that's for years it's been debated, it's been discussed, it's been, various things have been talked about. How long do I need to sleep? What's the right time? And and when I was doing some training at Oxford University, they almost said the amount of sleep you need is almost like a shoe size. Everyone's so different. Everyone is so different. So I know I'm probably around 7 hours of sleep for me. My wife, usually her best kind of sleep duration is probably a bit longer, maybe 8 hours. And people are just different in that sense. I've not had a look at the research in terms of empirical evidence as to whether women need more than men, but from experience, I suspect actually there is a general increase.
Hello, my name is Dr. Nguyen. I am a menopause and lifestyle specialist GP based in London. I started this podcast to help women over 40 to understand more about perimenopause and menopause and the knowledge that they need to navigate during this hormone transition. So today we will talk about the sleep health and how we can improve our sleep with a practical strategy during this hormone transition stage. So we have our expert guest, Dr. Karan, who had a special training in sleep recently, and we will be focusing on more useful information around this and how we can manage that. So, Dr. Karan, tell us more about yourself.
Yeah, thanks, Lynn, first of all, for having me. So my name is Dr. Karan Sandhu. I'm also a GP and I run a clinic based around lifestyle medicine and insomnia as well. And I'm still working in the NHS and doing some private work alongside that as well. And I'm a poet as well.
Oh, that's interesting. Yeah. So tell us more about the poet thing.
Yeah, so the poet, essentially, it started off a couple of years ago where I was in a train and I just started doing a spoken word piece and I performed it to the rest of the carriage.
Right.
And that's kind of developed. I've performed on TEDx stages at number 10 Downing Street, and I'll be at the British Society Lifestyle Medicine Conference this year performing there. So, you can catch it there. Yeah.
Congratulations.
Thank you very much. Cheers.
So today our topic is about sleep health. Yes. And you had a special training also. So, in UK, the British Menopause Society say that women, are during perimenopause and menopause, 40 to 56% of women can have a sleep difficulty. So the data is quite high. So in your opinion, why do women struggle with their sleep during that stage of life?
Yeah, I think it's such a good and also an important question. And you said at least sort of 40 to 56%, but even 25% have proper insomnia disorder, which is more than just sleep difficulties, essentially. And we'll definitely get into the definition of those sorts of things. To answer your question, what's the cause? I think there's a variety of causes, and I like to split them up into hormonal and non-hormonal. The hormonal have got the direct effects and also the indirect effects. So a nice little analogy that Professor Jason Ellis, behavioural sleep specialist in Northumbria, said, sleep is like a box. So imagine you've got a box and sitting on top of that box are these hormones that try and keep you awake, as it were. And when the box opens, that's when sleep happens. Yeah. So some of those hormones are things like noradrenaline, serotonin, dopamine, histamine, and also orexin, which is going to be important for later on when we're talking about treatment. And then we've also got things like GABA, which is in the box. And when GABA comes alive, that's when we do tend to fall asleep. And of course, there's various other hormones such as melatonin, cortisol, which again regulate our body clock, as it were. And then during the menopause, obviously, we have, a reduction in these sex steroid hormones, estrogen, progesterone, testosterone. And those can directly actually impact some of these hormones that I've just mentioned, sitting on that box, as it were, for sleep. And even I think we've been discussing before about progesterone, how that can also act as a GABA receptor agonist, or in some ways, and cause that sedative effect as well. So there's those direct effects, and then also the indirect effects, the vasomotor type symptoms, the hot flushes, increases our body temperature, and our sleep doesn't like increased body temperature at night time. But I'm sure you've probably can also speak about some other causes really for this period.
As a menopause specialist GP, of course, most of the women describe about hot flashes, night sweat, and how it can disrupt their sleep pattern. They can also struggle with things like getting up at night a lot, going to the toilet, and that can be another factor too. So you rightfully already say that, falling estrogen and progesterone really disrupt and, are causing all these symptoms, physical symptoms, affect the sleep. The other thing is like the falling and fluctuating sex hormone level can also change our internal body clock rhythm, and that can also be another reason why women have difficulty with the sleep. We can't ignore the fact about the social circumstances also, because when we reach the age of 40 and above, there are loads of things happening in our life. Career change, career growth, and it can also be like elderly parents that women have to look after, or it can be their children growing up, and a lot of social commitment that they have to navigate together with the hormone transition. So these are all going to be like a contributing factor to each other.
There's quite a lot of different factors really, isn't it? And it's hard to pinpoint which one it is sometimes.
Yes, of course. So you already mentioned about hormone and other non-hormone cause. So what other medical cause can contribute also to sleep problem?
Yeah, it's a really good question. So we know that also with age as well, things like melatonin naturally tend to reduce. In terms of other medical conditions and also medications as well, which we have to think about, there are various causes that can cause that disruption to our normal sleep. So there are things like thyroid conditions, even medications such as antidepressants, certain ones, anti-epileptics, certain stimulant medications. There's a really long list of those, steroid medications, thyroid medication, could go on, recreational medication. So there's so many different medical causes that can affect our sleep. And that's why it's also important. So whenever I see someone or a patient, I'm always taking a good history, because we have to think about what are the root causes. And there's a framework that Dr. Bhopal from the States kind of talks about called the REST framework. So R for root causes, E for entrain, which is the circadian rhythm, S for structure, sleep drive, and T is for transition and thought. But we'll get into those. But that R is root cause. What is causing the sleep disruption? And like you said, we've got those medical and sort of psychiatric conditions as well, low mood and anxiety, which we can tend to see can increase during the menopausal period. And then we've also got the other sleep disorders that we can't forget about. Things like sleep disordered breathing, such as obstructive sleep apnea, restless leg syndrome, circadian rhythm dysfunction, so delayed early phase of awakening. And that's why it's really important to take a proper history, because in menopause and perimenopause, we see things like sleep apnea rates increase.
Yes. So, during menopause and perimenopause, there are a lot of things happening, and hormone changes can cause a lot of physical symptoms, but we can't assume everything as menopause also. So you're right in saying that we have to start with like a good history taking and looking at the whole picture, and are there going to be any other causes that we have to consider and think about that too. So it's very important, for the full assessment.
Exactly, because especially like if someone does come in, we know as GPs, if someone comes in and they're tired, maybe tired all the time, of course we think about sleep difficulties, but we just got that in the back of our mind. Do we have to do a full workup for that tired all the time screen, look at some micronutrient deficiencies, and maybe do a sort of further investigation based on symptoms? So that's why the history still is always gold, isn't it?
Key, right? To look at everything. Yes, true. So in terms of what's happening in our brain, to get a good sleep, to fall asleep, to stay asleep, what is happening in our brain?
Wow. Yeah. So such a wide question. So we need sleep for, so many factors in the body. And something which I know Matthew Walker talks about in his book, Why We Sleep, is if you think about sleep, it doesn't serve much function when you think evolutionary point of view. So our ancestors, when you're sleeping, you can get eaten by a tiger, you're not reproducing, you're not finding food. Like, it doesn't on the surface look like it's got much function. And yet we're still here sleeping for whatever 7 to 9 hours per day. So there's got to be something in there that means that we need sleep. So look, we know it's important for learning and memory, neural development, emotional regulation. So I know if I've not had a good night's sleep, I'm definitely a lot more kind of like, irritable. And also, effects on the body, the cardiovascular system, metabolic function, and all these other health issues as well, which can be linked to lack of sleep. I guess there's different stages of sleep, and in those different stages, our brain is doing different things. So stage 1 is where we're kind of like, you've been on a long journey and you're sitting up and you're nodding off. So that often is that in-between state almost, which you can't really tell when you're lying down. Stage 2 is when our body is starting to wind down, but we've still got these bursts of activity on our EEGs, which is when they put electrodes on your brain. And that is when the body's sort of scanning and listening for noise to see, do I need to worry about that noise, or can I just ignore that noise because it's nothing I need to worry about? Or we're processing information. Then we get into the good stuff, the slow wave or non-REM stage 3, they call it, where our immune function is, improving, or just everything for our immune function is happening. Our learning and those memories are being consolidated. Endocrine, the hormones are all kind of being restored, and also something called glymphatic drainage. That basically just means just clearing up, in simple terms, clearing out the gunk from our brains, really. So it just shows they're the main processes that we see during sleep.
Yeah, so of course, during sleep, the first thing that happened with the brain signaling is like a melatonin, right? We have to have like a higher level of melatonin, which is a sleep signaling hormone. And they were higher up during that stage. And your cortisol, stress hormone level, need to go down. And then also your body temperature has to go down a little bit so that our body will be falling asleep and staying asleep. And all the things that you already mentioned, also different stage of sleep. Sleep is quite a complex thing, isn't it? So there are different cycles, like a sleep and awake cycles happening.
Exactly.
And that is quite important to understand, like it's not straightforward answer, yes and no, but it can be different stage that we have to look at it.
Of course. And then we've also didn't mention the REM sleep, that rapid eye movement, which is where we're getting our memories, emotions, everything's being processed. It's where, in the vivid stage of the REM sleep, we get the dreams as well. And something that, when I'm working with patients with menopause, the biggest thing or more commonly, I don't know about you and your experience, is that it's the frequent waking up in the middle of the nights. And yes, some people have problems getting off to sleep initially, but for some reason, I think the evidence support this, that it's the getting or the waking up so many times, broken sleep, all of these things are really problematic. And I remember I saw a patient recently who gave me her sleep diary, and I can see it looks like quite a fragmented, there's quite a lot of blocks in between there. But then we started some therapy for that, for insomnia, and some treatment, and now we've got some really good continuous blocks, which is really nice, which I'm sure we'll talk about soon.
Yeah, just like you mentioned, of course, there are different kind of like a sleep difficulty. Although they describe like a sleep problem, it can be harder to fall asleep, harder to stay asleep, fragmented sleeps, or early morning awakening. For me, what I see in my clinic usually is women say that they wake up early in the morning around 3, 4 a.m. and can get back to sleep. So what is your thought on that?
Yeah, it's really good, because even in the definition of insomnia, if we're starting to talk about more insomnia, it can be all three problems: falling asleep, staying asleep, and also waking up too early. And what you were mentioning earlier about cortisol hormone, about temperature, 3 o'clock, 4 o'clock seems to be that sort of, some reason, sweet spot where all of these processes are starting to kick in, especially if you talk about being hyper aroused, so in that fight or flight state a lot more of the time. All these things seem to kick in at sort of around that sort of time, essentially. So that's probably my kind of best estimation is why that seems to be the 3 or 4 o'clock issue. And because, like we said, we get these cycles of sleep that we've talked about, which last about 90 to 120 minutes, kind of these cycles across the night. So we do see different fluctuations depending on these factors that you mentioned.
Yeah, so I heard a phrase like something we call CAR, cortisol awakening response, which means like there is a physiological changes happening around between 3 a.m. to 8 a.m. Like you're going to be a little bit more in the awake cycle.
Yeah.
But it shouldn't make you feel awake. It is happening in the background, but people shouldn't be waking up at 3 a.m. and then stay awake that time because it's one of the cycles, and then you will be waking up at the time that you have after enough sleep, like 7 to 9 hours a night. So I think the other issue is like some other things are triggering the body to have a cortisol spike, and it is higher than the normal physiological level. And then people are more awake and alert during that time, and then harder to fall asleep after that.
Yeah, definitely. I agree. And as you're aware, with the drop in some of those sex steroid hormones, that can also impact that sympathetic flight or flight response directly, which can then impact hormones like noradrenaline. And essentially in terms of time, because I know some people ask me, they're quite interested, like, why is it this time? Why does that time? And how does our body know?
Yeah.
And that is where we talk about our circadian rhythm, which we've kind of alluded to, haven't we? We've just sort of teased it in there. And circadian rhythm is basically like your body's internal body clock. And the biggest, what we call Zeitgeber, where almost like a clock modulator, is always light. So we know that when light hits our eyes, our optic nerve has got various retinal ganglion cells that can tell, okay, are we in the dark or light time? And let's say it's evening time. If it's dark, that will then stimulate our little gland that got in the brain called the pineal gland, which then tells our clock, which you might see as SCN, so suprachiasmatic nucleus, but that is our ticking internal body clock. And from there, all our processes of sleep start to be modified. So light is a massive regulator of our circadian rhythm. And it's why it's one of the first and most key essential habits I tell people is trying to keep a regular wake up time. So the same time every day, because our body loves routine. We don't because if you think about it, let's say you wake up on a 6 a.m. every morning for work, and then maybe on a Saturday you sleep in till 10 a.m. and then the next day you're 7 to 8 a.m. It's the same as jet lag. They call it a social jet lag because you're changing your wake up time. And as well as that, after you've woken up, getting some bright sunlight within 2 hours of waking for at least 20 minutes.
Yes.
What that's doing is, obviously with sun protection as well, UV protection, but what that's doing is that's resetting that circadian rhythm. It's telling your internal clock, this is the time to wake up. And that is when good sleep starts. Not at night time, it's in the morning.
So yeah, it's very good point. You have to start our day like thinking about that day, like how we sleep at the night time. So yes, natural sunlight is really important to set up and align with our nature, and then get the circadian rhythm right from the beginning.
Yeah, exactly.
Okay.
Yeah.
So how about, there is a report saying that women need more sleep than men. What is your opinion on that?
Yeah, it's a really good point. So sleep need is one of those things that's for years it's been debated, it's been discussed, it's been, various things have been talked about. How long do I need to sleep? What's the right time? And, when I was doing some training at Oxford University, they almost said the amount of sleep you need is almost like a shoe size. Everyone's so different. Yeah. Everyone is so different. So I know I'm probably around 7 hours of sleep for me. My wife, usually her best kind of sleep duration is probably a bit longer, maybe 8 hours. And people are just different in that sense. I've not had a look at the research in terms of empirical evidence as to whether women need more than men, but from experience, I suspect actually there is a general increase. But ultimately, it's just so individual. And there's a really nice graph that shows from when we're born. Babies, obviously, we need lots of sleep. Teenagers, we still need lots of sleep. And then as we get kind of to adult, it kind of levels out. And then even as we get older, it can still go down a little bit further. But I don't know what you've experienced.
Yeah, so just like you said, sleep change with your biology too, right? As we get older, and depends on our social circumstances as how we live our life, it can change and adapt to how our life is, yeah? So what I can see from my reading and research is there is one thing coming out from University of Loughborough Sleep Research Center. It's widely reported data that women need 10 to 20 minutes more sleep than men.
Okay,
Yes.
good to know. Nice.
So it's kind of like a general data. So what they are
Yeah.
saying is like a generally all woman population. So
Yeah.
it can be because of the factor like women may struggle with more pain, like a period pain during the stage of their life. And sometimes it can be because of the childbirth, recovery from childbirth, and also other social care that they have to do for the baby or other people, right? So it could be other factor of that women may need more sleep than men. But there are also other hormonal factor. Obviously, we have to consider too.
Okay, yeah, really interesting. I kind of always kind of just knew it, thought it intuitively, but I hadn't looked at the evidence. So that's really good to know.
Yeah, that's good to know, isn't it? So yes, all the ladies out there,
Yeah.
we need more sleep than men, definitely. So next question is about how sleep can affect our performance and productivity, in our life.
Yeah, I mean, there's definite impacts of lack of sleep on various aspects of performance. If we're talking more about performance now, they've studied, especially bringing it back to women with menopause. They know that when we treat those sleep disturbances, daytime functioning improves, mood improves, work performance improves, mistakes go down. We even know, if we extrapolate a bit more broadly, there are fewer accidents on the road. When our clocks change every couple of years, there's always a little bit of, I'm not sure about the robustness, but there's always an evidence where our rates of car accidents increase. So the cognitive benefits are just huge. And it's why pilots, F1 drivers, athletes are always investing in their sleep, about how they can get that performance edge. And even if we look at runners, marathon runners, one of the biggest performance improvements that they can do, or performance enhancers, is sleep. Sleep, we know that extended sleep can help all of these things. And if we look at the physical health aspect, almost every organ in your body responds to it. We know there's associations with poor sleep and sleep deprivation and insomnia, with cardiovascular disease, metabolic disease, diabetes, certain associations, so not causations, which is really important to just to note there, with various cancers, breast cancer and prostate cancer. There's been, again, just associations. So I'm not saying there's a direct link, but just something to consider, falls risks. And this is where I find the sleep really interesting, especially when I talk about sleep, is I'm very conscious about educating people about lack of sleep, but also try not to scaremonger them. Because if we start thinking about insomnia, one of the drivers and one of the beliefs is, oh my gosh, I can't sleep tonight. If I don't sleep tonight, I'm going to have this problem at work tomorrow. I'm going to have this risk of cancer or heart disease. Oh my gosh. So I'm very conscious of talking about the effects of poor sleep. But when I'm doing my cognitive behavioral therapy, I don't really talk about it too much, because short term, couple of nights, sleep, short periods of sleep is not going to have a massive impact across a lifespan, across risk. But everyone knows, as I'm sure, that when you've not slept as well, you're not firing on all cylinders. But that can sometimes be just what's getting us in the way of getting the sleep. So it's the world of paradoxes. I find it really interesting.
Yes, that's true. For me, it's like a woman during perimenopause and menopause. They have predominant symptom like hot flashes, night sweat. But the other thing is the brain fog. So brain fog is like an umbrella term that we say, like difficult to find the phrase, or losing train of thought. Sometimes women say like it's a cotton wool hurt, and then it doesn't feel right. You have like a lack of concentration and all these things. These are part of hormone fluctuation and hormone changes. But if a woman also struggle with sleep on top of that, it can definitely intensify the symptoms. And we see a lot of women over 40 are in a high executive position, leadership position. So they have to, keep their concentration up to the optimal level to perform well.
Yes.
And there is a data from government UK saying that during this hormone transition, because of all the other symptoms, including sleep and other menopause symptoms, women can have losing confidence, it can affect their performance, and also gradually, like in terms of workplace retention, or, are losing a position in some case. So it's quite important to manage the sleep alongside the other symptoms.
Definitely. That's a lovely point you made there about brain fog in itself can be problematic. And then it's made worse with lack of sleep. So
It's more like intensifying the
Yeah,
symptoms also when your body is not at the optimal level.
yeah.
So yes, we all have bad night's sleep. I do have some night that I can't sleep and stress about it, just like you mentioned. So when is it become clinical condition like insomnia?
Yeah, really good question. So essentially insomnia, if you're looking at the formal definition, it's problems with getting to sleep, staying asleep, or waking up too early is one part of it. The second part is it needs to interfere with your day-to-day function. So it needs to make you irritable, make you moody, make you feel always tired. So you have to be struggling during the day for it to be classed as insomnia. And then we start looking at number of times a week. So we say at least 3 times per week if you're experiencing this. And then we go to duration. So technically it's 3 months, but most sleep specialists, if it's been going on more than 2 to 3 weeks and you're struggling, then it starts getting into that what we call chronic insomnia aspect. Acute insomnia is basically any couple of nights, within a 2-week period where you're having some problems sleeping. So that's how we typically define them, acute and chronic.
Okay. So what are the treatment for insomnia?
Yeah, I think the best way to understand the treatment is almost to understand the model for what's happening in insomnia. So one of the major models is from Spielman in 1987. And he talked about the 3 Ps model of insomnia. And I think it's really relevant to people that are experiencing perimenopausal or menopausal symptoms. So the 3 Ps, what are they? Number 1 is that predisposing. So what are those almost risk factors, those traits that make someone more prone to insomnia? So we know it's certain biological traits. We know that potentially women are more affected, older age more affected, certain personality traits, so anxious personality types, perfectionist personality types. These kind of underlying almost character and biological traits are in that predisposing. They set the scene almost, but we're still not at insomnia, okay? The next P is precipitating. So what is that event that just throws someone's sleep off? Is it becoming a new parent? Is it a illness? Is it the next door neighbor just bought a new boombox and is playing the loudest tunes all the time? Is it menopause and perimenopausal issues? Okay, so what these do is they precipitate, they knock your sleep off track. So we've got that predisposing, we've had our sleep knocked off track, but we're still in that short-term insomnia at this point, acute insomnia, as it were. The next P is the interesting one, and this is where I spend a lot of my time focusing my treatment. Yeah. That is perpetuating factors. What keeps this sleep problem a sleep problem? What keeps this going? So then what happens is, and I used to be guilty of this when I used to struggle with sleep, is that I'd have a really bad night of sleep, and then I'd say, okay, the next night, I'm going to go to bed really early. I'm going to get into bed an hour earlier. I'm going to catch up on all of my sleep. Or maybe I might have done things like having a nap that rest of the day. Or I would start to develop a bit of a fear almost of the bed. So all of these things are perpetuating your sleep problem because it becomes a bit of a cycle. And that's where we get into the chronic insomnia. So interestingly, the thing that could have thrown your sleep off in the first place, that could have been solved. So let's say it's depression, let's say it's the boombox, the person with a loud boombox, that could go away. But because you've almost been conditioned, you've had that hyper-arousal state, because you're doing behaviors like going to bed earlier, staying in later in bed, you've now got this cycle of sleep itself, and that is chronic insomnia.
Yeah, so it is kind of like, start as something acute, but then it can turn into chronic because of the fact that our mind and body is talking to each other in some way, isn't it?
Yeah.
So in terms of like, mood and sleep connections, that is what happening, isn't it? We are feeding back to each other, like our brain is telling our body, like, yes, making a pressure to fall asleep. And then the body also kind of like, try to respond to the signal.
Yeah, pressure is like the the perfect word for it, because it almost becomes like, oh, it's sleep time now. Oh, I wonder if I'm going to fall asleep today. Oh, I've got this big meeting tomorrow. I really need to fall asleep. But okay, I just won't think about it, because if I think about it, I won't sleep. And it just becomes this thought loops. And that's where Moran was the next researcher who added an extra bit to the model, the Spielman model. And he started giving us this cognitive behavioral type model where we have these thoughts, these ruminating thoughts like, if I don't sleep, I'm going to have this health problem, or if I don't sleep, I'm going to mess up tomorrow at the big meeting, like you said, some of the women that come and see you. And then that then becomes into almost behavior. So then we start thinking, okay, I'm going to go to sleep earlier, like we said. And then that doesn't help you sleep. So then you have the consequences where maybe you do make a mistake here and there. And then that feeds into your belief to say, yes, see, look, I knew it. I was right. I'm never going to sleep. Creates an identity. So as you can see, we've got this thought loop of thoughts, behaviors, consequences as well. And that is where we start thinking about cognitive behavioral therapy for insomnia, which can essentially target all of those little bits and pieces.
Yes. So for chronic insomnia, cognitive behavior therapy for insomnia, CBTI, is the first line treatment. Is that right?
Yes, correct. So in NICE guidance now, it is the first line treatment. Various meta-analyses, lots of studies prove its effectiveness. Works in 80% of people, lasts at least 12 months, reduces symptom severity by half. It can, work, like I said, more effectively than medication. That's not to say some people may need some medication. That's a personal decision with their healthcare professional, whatever's right for them. But generally, CBTI is the first line for chronic insomnia.
So in terms of sleep difficulty, and if that turns into insomnia, there are treatment options available. And one of the good things about CBTI is it's target the mind-body connection. Yes, try to make you break the cycles, and then try to make you feel better or more in control of your own thought and behavior, and then that help you with the sleep.
Yes.
There are other things about with the perimenopause and menopause, we have to consider what is the our contributing factor for sleep problem. It can be a combination of factor. One can be hormone fluctuation, hormone imbalance. There are other factors like these thought process and getting into the loop of behavioral cycles, and it can be other social factor. So looking at the whole picture and combining treatment can be beneficial for them. Things like hormone balance and treatment at the same time, if there is additional our condition underlying about behavioral or psychological cause, CBTI can be a perfect combination.
Yes, exactly. And I'd love to kind of get your thoughts about, with your experience, about almost combining the two. So treating that underlying cause, which is the menopausal symptoms and all the physical, the physiological, mental, emotional impacts that come with menopause and perimenopause, and also treating insomnia as its own condition, because that is now where we're seeing, we know it's a cost of about 50 billion to the economy of insomnia based on presenteeism at work, so being at work but not really showing up, absenteeism, sick days, and the relationship, I guess, of insomnia being its own disorder. Because before, it just used to be a symptom. People used to say, oh, you've got low mood and, you're having trouble sleeping. It's just part of the depression. But we now know, so with CBTI, if you do CBTI to treat the insomnia, insomnia gets better and the depression can get better. But if you just did CBT just for depression, the insomnia doesn't go away. So that really kind of highlights that it's a standalone treatment therapy as well. And just to give an idea, if that's okay, about CBTI, because then I'd love to hear about how you manage the hormonal aspects and the treatment aspects. So one of the big things about CBTI is what we call sleep restriction therapy. And it sounds a bit of a scary name, and it seems like, why would I want to do that? And, this is obviously best done with a professional, with a CBTI practitioner. There are various apps that you can look at now, and I can put some of them in the show notes. But with a practitioner, what I'll typically do is look at restricting the amount of time we stay in bed. Because what can happen is, so I know I've been working with a patient recently, and she'll get into bed at 9 o'clock and then she'll want to wake up at 6 or 7 o'clock. So that's become about 7 or something, 10 hours in bed there. But she's only sleeping about 4 hours in that night. So if you look at her sleep efficiency, it's about 40%. 4 hours in bed, 4 hours of sleep, 10 hours in bed. So what we try and do is we try and restrict that amount of time she's in bed so that it gets more of a routine, her body becomes very sleepy, and then essentially it can be very difficult in the first couple of weeks because you're having to restrict their sleep. But we do sort of at least sort of 5.5, 6 hours of sleep, and it also depends on the person, and making sure it's safe to do so as well, because you don't want to be doing some of these things in certain populations, and so you have to just be wary, and that's why having a professional is really helpful. And that is got one of the biggest drivers of CBTI and the benefits that we see, especially in menopausal ladies. We've seen the benefits on daytime functioning, work performance, and it's been studied. And then you said mind-body connection. I find this really interesting. I'm sure I know from your background in lifestyle medicine, you find it interesting as well. But that hyperarousal, that fight or flight, people almost see the bed as a threat. Honestly, and they see being awake as a threat. So when you're lying there in bed and you're awake, your brain, you've conditioned yourself to your brain to say, oh my gosh, I'm awake. Threat, sympathetic, fight or flight. Pupils start dilating, heart rate goes up a little bit. You just become on edge and you can feel it. And that's part of a lot of the work that I do and I really enjoy doing, like reducing that sympathetic tone. Have you seen similar things in your
Yes, you're absolutely right, because our mind and body truly connected. Yeah, so if you start worrying about, oh, why can't I fall asleep, it will give these negative feedback to your body, and then cortisol spikes happen, stress hormone level rise, and then your body physiology change, and then you can't fall asleep, isn't it? So it's very important that you only go to bed at the right time every day, and then only when you feel like you want to sleep, not go there early, watch the screen or anything like that. That's something we will talk about in the lifestyle strategy, how to manage and then get the better sleep by doing the lifestyle changes. In terms of like a menopause and perimenopause, it's more like a combination of factor like we spoke before. So if it is the predominantly hormone fluctuation and a woman never suffered with sleep problem before, we can, think about like the first step will be balancing the hormone. But if they have other contributing factor together, and it is very important combination with the CBTI and then hormone replacement treatment in some way, if it is safe to do so and if it is good for them. So looking at the whole picture, individual approach is very important, isn't it? Case by case.
Of course. So when you give hormonal replacement therapy, what have you seen? What have the effects been that you've seen with your patients when it comes to sleep?
Yes, so it's a very good question. So if a woman struggle with sleep, predominantly because they go through these hormone fluctuation and hormone changes, no other psychological reason or social reason behind it, then hormone replacement therapy, if it is safe to start, or if it is a correct dose for the woman, it can start showing the benefits in a few weeks. But some women, it might take about 12 weeks, to see the benefits.
Okay, yeah, great.
So how about CBTI? How long does it take for for someone to see the benefits?
Yeah, again, it depends on the person. So they'll say like 6 weeks to 8 weeks is a standard length of time. But to give you a nice little success story, as it were, so I've been working with someone at the minute. I've only had, we've only done 2 sessions so far. We've done some sleep restriction. We've talked about some of these other quick wins and the lifestyle habits that have helped. And we've started to talk about those beliefs about sleep and tried to reduce that hyperarousal. She was really struggling. And, I think actually the last call that we had, she said it's the first time that she can remember that she slept 6 hours straight for her, which for her is like fantastic, amazing. She was waking up every single time, and then she felt great at work. So that was only really about 2, maybe 3 weeks of doing the treatment and going through the process of CBTI. So actually for some people, within 4 weeks, within 3-4 weeks, you can start to see some changes.
Yeah. So there's always like that variable timeline, isn't it? For some people, it will be quite quick to see the benefit. For some people, it might take a little bit longer. But if it is a right tool for them, they can see the benefit quite pretty soon.
Yeah, definitely. And I guess in terms of, because I know obviously we are GPs, we love lifestyle medicine, but we also sometimes prescribe medication when needed, evidence-based and appropriately. So I know you mentioned hormonal therapies, if it's correct and the correct dosage. What other kind of medication or pharmacological therapies, and I'll chip in some bits with the sleep side, but I guess from that menopause, perimenopausal side, have you given that maybe like help with sleep?
Yes, so it depends on the case by case again, an individualized approach. Apart from hormone replacement therapy, we are looking at the other factor, what is contributing factor for this sleep, just like you mentioned about the precipitating factor and then any other trigger factor, isn't it? So just like, you and me, we are both GP with a lifestyle medicine specialist interest. So just like many other doctors, we don't like prescribing sleeping tablets because there is a high risk of addiction if you use it repeatedly or regularly. So our aim is looking at the whole picture and then looking at other alternative approach. So things like, magnesiums can be quite useful these days. Many people are start taking magnesium supplement already before they come and see the menopause doctor. So they are already on like a magnesium and other complementary therapy for the sleep to help with their, our sleep quality and everything. What is your thought about magnesium supplement?
Yeah, there's definitely been a big flurry of magnesium coming out, isn't it? Definitely. And this is an interest. This is a broader conversation about the wellness industry and health and how everything's interacting with each other at the minute. Probably one for another day, that conversation. But magnesium, it's had a lot of fanfare, and I know a lot of people have said that they've enjoyed, that it's been beneficial for them. It's magnesium glycinate can help with their, sleep at night times. If we look at evidence, though, meta-analyses and actually having a look at what actually works, essentially unless you're deficient, taking magnesium in a healthy person, there have been some associations with reduced cardiovascular comorbidity, metabolic issues, and sort of sleep. The tricky bit is that's been dietary magnesium, so is that because of the magnesium, or is it the fact that they're getting a good, normal, healthy diet as well? So I try where possible to really recommend dietary magnesium sources, that are leafy greens, just because that generally does the trick for most people. So for me, I need to have a look at a bit more evidence, but I'm, I guess, a bit more skeptical at the minute about magnesium supplements for sleep based on, pure evidence. But I think a lot of it, the placebo is good, and if you've got a deficiency, if you're at risk of deficiency, if you're taking certain medications, PPIs, for example, acid tablets, certain of those, then maybe you can think about supplementing with magnesium. But generally, healthy individuals, if you've got a whole foods diet, you should be getting enough magnesium in there to prevent any deficiencies. But interestingly, other people say that it works great for them. And then you think, okay, I mean, if you're just taking a supplement, if we're weighing up risks and benefits, and you say that when you stop it, you don't sleep as well, it's having that individual discussion with a patient, really.
Yes, that's true. So with like you said, a supplement industry, it is harder to get the evidence-based data around it because the research comparison to other medication that we prescribe in the mainstream medicine, it might not be strong enough when you compare that data and stuff. But I agree, most of the people come and talk to me like they've been taking magnesium as a supplement and that they find it somewhat useful, and some people find it like a really beneficial. So there are different type of magnesium, and just like you already mentioned, magnesium glycinate and magnesium citrate are better at absorption. So it is better to help with the sleep quality. And taking the supplement about 200 to 400 milligram 30 to 60 minutes before sleep can be beneficial for some women, because at the end of the day, it's kind of like a multivitamin supplement. So it's not going to cause you harm. And then if it's something that you want to try, and then people can try and give it a go for up to 3 months and see if that works for them. If it is work for them, it's good. But I agree with you, like focusing on diet as much as we can. If we eat like a leafy green vegetables, it's not only magnesium, it's going to be like complex fibers and irons and other nutrients that we can get from it at the same time. So it seems to be like the first approach that we need to focus on.
Yeah, definitely. Really interesting.
Yes, that's really interesting, isn't it? So we talk about nervous system regulation earlier on. So let's deep dive into that. So what is nervous system regulation?
Yeah, I've got a really fun so there's something called HRV, and I'm going to start here actually. And HRV measures, broadly speaking, there's two types of our nervous system. So obviously we've got a nervous system that says that I want to lift my hand up right now, and it controls that. We've also got this thing called the autonomic nervous system, which are these constant processes that are keeping us alive, going on in the background, controlling our heart rate. And broadly speaking, you've got the sympathetic and the parasympathetic. So that sympathetic is that fight or flight. You know, you see a lion coming at you, all your blood flow goes to your legs to get out of there. You're on high alert, cortisol is going up, noradrenaline is all going up. Then you've got the rest and digest, which is when you're relaxing, things are just taking it easy. And what I'm finding, and I don't know about you, but the same with modern society now, people are seeming to be in that sympathetic system a lot more. And I always ask when I do some of my talks, I say, what animal do you think of when it comes to stress? So what animal do you think of when it comes to stress? Anyone?
Well, tiger.
Yeah, it makes sense, right? Or lion or something scary.
Something scary.
I always say zebra.
Oh.
And the reason I say zebra, there's this book by Robert Sapolsky, one of the leading stress biologists, called Why Zebras Don't Get Ulcers. Yeah. And I don't know if you remember back in the day that people used to think that chronic stress causes stomach ulcers. We know it's like not really true, but obviously in certain like ITU situations, it can have stress ulcers. But other than that, it's not really true. But at the time, the concept of the book is that when a zebra is being chased by a lion, they're very scared. They're sympathetic. They're on fight or flight. Mm. When they escape, though, the next day, they're not thinking about that lion again. Whereas humans, we constantly think the lion's coming for us. Oh, deadline tomorrow. Got to do the washing tomorrow. We're always on edge. Zebras aren't thinking like this. Mm. So we're having that constant fight or flight that's just always there, that underlying stress, which is causing problems for us. And especially insomnia when we're trying to rest. If we've got that fight or flight turned on, then it's definitely something that can interfere with sleep.
Yes, again, it's like a playing the game between our mind and our body, isn't it? How our body is responding to these like a stress response, right? Fight or flight response system. So nervous system regulation, as I read about it in the simple term, is like the body ability to get back to your natural baseline calm state.
Oh, I love that.
So it's kind of like a transition from the fight or flight response to the calm state.
Yeah.
So I think different people might have different strategy how to get back to regulate their nervous system. But these days, because we work both in lifestyle medicine fields, and we can see that things like, breathing technique, breath walk is quite popular these days to calm down your nervous system. And other things like grounding. Have you heard of it? Grounding is a strategy that you can use, like how you can align with the nature early in the morning, get out in the garden or somewhere with the, a natural ground, and then put your feet on it and then get aligned with the nature, and you can have these electrons from the earth going through your body, and then it seems to work for some people to have a better quality sleep also. So grounding is another technique, and of course other lifestyle factor is also important in terms of how we can regulate our nervous system.
Yeah, definitely. Such really good, nice examples there. And in menopausal women specifically, there's been some evidence that shows that PMR, so progressive muscle relaxation, has been really effective in one of these relaxation strategies when it comes to sleep. And also autogenic training. So that's basically relaxation therapy, saying things like, I feel warm, I feel heavy, these kind of verbal things that you say in your head that just make you relax. So those two are some nicer techniques, especially for people with menopause that they've found.
Nice. These are easy techniques, simple techniques, and you can also start doing it, right, in a simple way. So magnesium also seems to calm down the nervous system in some way, and also it can help with the muscle tension and muscle relaxation too. So that's why I think people are more into magnesium these days in some way. So we have to talk about melatonin also. Just like we mentioned, melatonin is like a sleep regulating hormone, isn't it? So we do know that melatonin also comes as a medication form. What is your thought on that?
Yeah, so at the minute, melatonin is quite a wide variation across the world. In America, you can just go to the pharmacy, get some melatonin off the shelf. Yeah. And they seem to just take it, all the time if they can't sleep. That's generalizing. Obviously, I'm joking a bit as well. UK is a bit more controlled. So here, even the NICE guidance says if you're above the age of 55, you can try maybe like a 3-month course of melatonin if you've been struggling and you've tried the CBTI. But even then, if you go and try to prescribe it on the formulary, depending on where you are locally, you might not be able to prescribe the melatonin. So it's an interesting one. I find it works best for circadian rhythm disruption. whether that's certain jet lags, whether that's proper delayed phase or early phase wake disorder with regards to circadian rhythm. That's where it can help quite well. There's some small scale studies that did mention that sometimes a little increase in blood pressure, blood glucose as well, and you have to be careful. And I wouldn't give it to teenagers really either because of effects on, again, small scale studies on puberty, even though it's used in a lot of younger populations with ADHD. But it's just things to keep an eye on and have that discussion with your professional. Those studies, it's important to say, because anything we say on a podcast is very easy. You might be listening and hear something and say, I need to stop this now. But obviously we're talking about generalized data. Yes. Some of these studies are also small scale as well. So it's always worth speaking with your health professional. But melatonin is something that we can use, especially in that older age group when it comes to purely insomnia or circadian rhythm disorders generally. I don't know what your experience has been like with it.
Yeah, so you're right. Melatonin can decline with age, but they are more in like a gradual decline in comparison to like what we focus in on hormone decline during perimenopause and menopause. So it's a different form of decline.
Nice, yeah.
And it will come more gradually, and then we see the decline only more in the later stage of life, you know? So in terms of using melatonin as a supplement or as a medication, I agree with you. Like I see a lot of people in the private clinic, sometimes they come from America and they already been on melatonin or they try it now and again. Yes, so it is more useful for something we call sleep latency, like a falling asleep. Some people say like it doesn't really benefit for staying asleep or early morning awakening, which is a different phenomenon, isn't it? So it might be depends on what type of sleep difficulty you have, and I always need to speak to the professional because it has to be individualized and it is not for everybody, and it also without the side effect or risk. So we should be more focusing on how to boost or how to improve our natural melatonin in our body, right? We already have the hormone in our body, and our aim is like to help people to understand that there are loads of lifestyle things that you can do to improve your natural melatonin rather than going into the artificial one.
Yes, really nicely put. That is awesome. I love that.
You can write a book.
Yeah, you should definitely write.
No, I'm joking. But in terms of the melatonin, we talk about melatonin. We talk about other medication already. So let's talk about lifestyle medicine, the practical strategy, isn't it? Yeah, that's what we like to talk about. So what is your thought on that? What is the most efficient and beneficial lifestyle strategy?
Yeah, sure. So this is where I come back to that framework. We've talked about rest. So R for root causes. Then we go into the E. So that's entrain. And what that means is getting that body clock we were talking about into a nice natural rhythm. So the first thing is light. We know that early morning light resets that circadian rhythm, but also the light you get throughout the day is just as important. I'm always thinking of the best way to describe this, but the more light you get during the day, the less sensitive you are to light late at night. So if you've been out all day, let's say you've been to a festival, outdoor festival, lots of daylight, when you then come in the evening, if you have a bit of exposure to light, it's going to have less of an effect on you. Okay, so being outdoors is really good. Food, when we eat, so important. I say at least 3 hours before bed, not having any food, just because digestion, temperature increases can also impact sleep. We look at activity, staying active throughout the day, exercise, walking, jogging. Then, of course, there's obviously what we eat and drink. So caffeine, at least allowing 6 hours before bed is really important. Alcohol intake can also make our sleep worse. So there's quite a few lifestyle wins and things that we can do to help. And then, like you mentioned earlier, going to sleep only when you're tired and doing, I guess, keeping your bed the bedroom, basically. So not doing other stimulating things. I know people are checking emails in bed, and that's going to create this conditioning, this where you just think the bed is where you do work and not sleep.
Yeah, so just like you mentioned, it's the part of the modern life, isn't it? Because we are on the phone all the time. Everything that we need to check is on there, and even though you're not actively checking on it, when you look at the phone, there might be some notification come up, and then that might alert your system. So it's very important to limit the exposure to the blue light as much as you can before you go to bed. So at least, like you mentioned, not eating, no food or drinks a couple of hours before you go to sleep, and also not looking at the phone at least 1 hour before you go to sleep is really important. Natural sunlight is the key, so I totally agree with that. So what is the key message you want to talk to our audience about what they can change? What is the most important lifestyle change that they can practice to help with their sleep health?
My keystone habit would be waking up every single time where possible at the same. So waking up every single day at the same time where possible, and exposing yourself to some natural light within 2 hours of waking would be my.
Yeah.
If I could just choose one,
Yeah.
I think that would be the big one, really.
Yes. So for me, it's like for women who are going through changes between perimenopause and menopause, it can be combination of factor. The most important three things that can be interconnected to each other is hormone fluctuation, high level of anxiety and stress, and at the same time, like poor sleep. These three things are the most important thing that we see in our clinic, and they are all interconnected to each other because they send a signal to each other. So sometimes looking at the whole picture and then thinking about balancing hormone at the same time, different lifestyle strategy, if they need to think about behavioral therapy, something like CBTI to calm down their nervous system and also sleep disturbance, alongside the other lifestyle tools about looking at the nutrition and regular movement and align with the nature. Make sure that you have a natural daylight as much as you can in the daytime will be the key message.
Wow. Yeah. Amazing.
That's great. Thanks for coming today for the podcast.
I've had so much fun. I feel like we could do another 3-4 episodes just on lifestyle medicine and so many other aspects of such a big topic.
This is a huge topic, but you give us so many useful information about sleep and especially like a CBTI and how it can impact on our sleep health.
Yeah, thank you so much. Always learning from you, Dr. Lynn.
Thank you.